Good morning, good evening, and for those who are sleeping yet, good night. So now in today's class, we are going to tackle how to answer exam questions. Majority of you have been inboxing and sending into my email suggestions like how do we handle questions, just help us on how to go about this. So I thought why not have a sit down and help us on how to handle this. So in this class I'm simply going to help on how to get few tips on how to handle the different exam questions. So if you're new here, my name is Winnie Barawa and join together with us in our Medic Academy. First and foremost, before we go to how do we answer the question, it's first good to understand how many questions or what types of questions are we first expected to deal with in different exams. So I will take us through how questions are actually categorized so that will guide you during that exam time so that you understand these questions is basing me in which category. History, there was actually a person known as Bloom's who came up with a categorization of cognition. Cognition is how a person thinks. So in this categorization, Bloom's takes us through understanding of how thinking happens in our brains, and he has this category done in two ways, where he says our brain could either be in the low order thinking or in the high order thinking. So this is the same criteria our teachers or lecturers or trainers use to actually generate questions. So I want you to note, as you look at this pyramid, the base is huge and the apex keeps tapering, meaning from the base, it's a stage where we expect majority of us to be able to handle that category, such that this pyramid moves from the stage of remembering all the way to creation. So as we keep going higher, we are expected that our thinking should be improving and becoming more high thinking in that stage. So Bloom categorized our thinking, or our abilities in thinking and evaluating situations in 6 categories. So we have remembering, understanding, applying, analyze, evaluate, and create. So when we join college, the first year of our school is mostly introduction level. So you're taught stuff. So most of these levels, the teachers, they ask you questions that are more of like recalling. So they don't ask you difficult questions per se. They ask you things that show you are able to recall. But as you keep studying, we expect that your ability to analyze situation and think keeps improving. So the questions in your life keep going higher in terms of what you're supposed to be thinking. So they start adapting levels of understanding, applying, analyzing, evaluating, and also creating. So I would like to go into these levels one by one so that we are able to understand all of them. So this is how they set the questions based on the levels. So this is how your exam questions will be targeting you to do when they state those various questions. So a good example is sometimes you're asked something like recognize, list, label, or arrange. Those are the names we know. But now, at the back of the mind, you need to know that what is my teacher expecting me to do in this question. So in these questions, when they're giving you, they are trying to stage you into these levels of Bloom's taxonomy. So like in the level of remember, the basic level, it's a low thinking order, or it's a lower thinking order. So in this case, when the person is targeting you to remember, they use names like arrange, define, identify, indicate, labels. They look very straightforward, like they are not really trying to make your brain overthink and relate things. No, we just want you to remember. And this is where most students suffer from, because they are basing most of their answers based on memory, forgetting that some questions are high thinking order, which are not just taking you into memory. If you, let's say, list the risk factors for asthma, that is a memory question. It's not trying to make you think around it. No, just give the memory, give the remembrance of the list, the way you're given. If you know the points, just list them. Here you can use names, you can use crosses, you can use things. It's a list, it's a memory stuff, so not that hard. But now we go up. We start now going higher into the order of thinking. So you find that some questions come with other way of asking it. So let's move to understanding level. When you're at the understanding level, you're now expected to translate and interpret the knowledge. So this level, we are not remembering anymore. We are not using memory or what you crammed in what you read in the notes. This level, the teacher wants you to have understood what was taught, and now you are able to apply what was taught in your exam. So in this case, they start giving you questions like compare, classify, describe, discuss, explain, and sometimes they want you to give examples. So this is something that needs you to have understood what was taught. At application level, this is now applying. You take the knowledge that you understood and now you are applying it in the exam. So let's say you are taught a formula of how to calculate dose of drugs. In this case, when you're given the question, now application means you take that formula and apply it in that exam. So you'll find questions like calculate, complete, demonstrate, execute, illustrate, and so on. So most of this time they come in practical stage. You find most of the questions in practicals come under this level of apply. Let's say you are in the clinical area and they tell you to demonstrate how to inject this patient, or they tell you to demonstrate how to make a certain procedure. So these are more applications, and they also are trying to carry you along. Do you remember? Did you understand? And can you now apply? Analyzing is now you breaking down what you remember, understood, and applied, and giving us your breakdown of this information. So here you will find questions asking information about categorizing, contrasting, comparing, critiques, debating around. These are quite deeper. So here you need to see even how even the questions are being stated. They want you to give us a deeper analysis of how you are able to have understood and applied the information that you have. Analysis level, evaluation level, here you are making judgment now. So for instance, you gave a drug and you have administered this, the famous drug we know is paracetamol, for instance. So you have administered paracetamol. So the teacher, of course, will now ask you, what do you expect to be the results after 1 hour, for instance? So in your mind, you're not expecting you to memorize like the effects of paracetamol. No, we want you to tell us which expectations do you understand that will come out of the interventions you've given. So in this case, you want you to have a clear ability to evaluate your actions, your understanding, your knowledge, and anything you put in place that you had done at an analysis level that could lead into an end result. So these evaluation questions, they are a bit very deep, and sometimes they are used in oral exams. So you find out evaluation level, they come a lot in oral levels when maybe you are in the practicals and they want you to explain a case, to defend your case. So most of the questions here, they use a lot of words like justify, recommend, can you give us your argument around what you've done, can you assess. So these are quite deeper questions. They don't come in theory exam per se, although some universities and colleges also like using evaluative questions, but you may not find them a lot in written theory because it may not make sense. Most of the theory written papers, they have a lot of remember, understand, and apply. Right? It's a place where you have literally cracked all these other levels, and you're now into the level of innovation. And by innovation, we mean you are generating new ideas. So you are these people who are into discovery, creating new things, like you want to discover a new vaccination, you want to discover new ways of studying. So this is a bit detailed. So in this case, the main agenda of creation is compiling information to generate new solutions. So here it's a bit deep, and majorly, like I've said, you will find it also in the higher levels of studies, PhD levels, or in these smaller levels. You also may get these levels being asked maybe at a research level where you are told to give a hypothesis of what your research is targeting, because research is supposed to help you also have a prediction of what you think your research topic could actually discover or not discover. So these are very, very higher level. So the most questions we get asked in our exams is list, state, explain, describe, and other questions I'll still come to. So now under list, like we saw in the diagram, is that this list is just looking at your memory, memorize, and in listing you are even allowed to use numbering, you are allowed to use hyphen. You're simply listing. Do not generate a sentence in this level. You're simply giving points as you know them, as you remember them. That's it. Listing doesn't need you to explain anything. Just put that point. If they ask you, let me repeat, what are the risk factors of asthma? Okay. In listing, you don't need to write a sentence in it. Just write allergens. That's it. That's done. Stating now, it's still memory, but at this level, you're not listing. So most of us confuse listing and stating. At stating, you're not listing. You are giving your answers, but you will be giving in terms of a sentence. Okay? So for example, you're told, state the risk factors of asthma. That question is no longer the same as list the risk factors of asthma. Stating is now telling you to give those points, but you're giving it as a sentence. Okay? So it's always advisable to write, the basic English that you know. Don't use huge English or imagine you need to write a sentence that is in a very complicated way. No. Just calm down. It still follows point form, but in this case, you write it as a sentence. So in this list, we said allergens. But now in stating, you will write a sentence. Like, it is caused by allergens. It is promoted by other respiratory infections. You write a sentence. Don't just write a point there. Don't list. Then let's go to explain. Okay? Explain. What is explanation? Again, most people get confused on how to explain. Most people, they also stick explanation into stating. So you're telling someone, explain the risk factors of asthma. People get stuck and they keep now listing risk factors. So when you list, unfortunately, and you've been told to explain, you lose a point. So if the answer was, if the marking was 1 mark per list per point, you end up with a half. So when you're told to explain, it's now safe you do this. Put a point, put the main point, and then explain it. So if the risk factors is allergens, okay, so how do you keep safe in explaining? Write there allergens and then introduce a sentence on the next side. So this is a mix. So explanation, it's a mix of listing and stating. Okay. So in explanation, you're putting the points and then you introduce a sentence to explain it. So when you're told explain the risk factors of asthma, then you will write there allergens. And then hyphen, write more about these allergens. So you can go ahead and say asthma can be caused by allergens such as dust, perfumes, food additives, or drugs that can lead to development of this respiratory reaction. Under description category, here you're deeper than explaining. So in describing, I always tell people, be careful, avoid using congested paragraph. Okay, so the number one trick when you are describing, use a paragraph, but avoid congesting the paragraph. Most people, when they're writing, they write paragraphs that seem as if they're continuous. And then please do not number your paragraph also. Because if you number your paragraph, you are starting to list. Because listing, we have said, is the only one that is using numbering, bullets, and all that. So at description level, use a paragraph. Advisably, you can subhead your paragraph to describe. So if you're describing, mostly description will come also at areas where you're introducing management. So I told describe the management of asthma, for example. Okay, so let me give you an example. Describe the management of asthma. In this category, because it's a description question and you're describing the management, of course, being in the medical field, You need to prioritize your care and start with the main one in this asthmatic patient. So in this case, in asthmatic patient, most of the first line management, you start with nebulization. So in this description, start with nebulization. Start there, nebulization. Okay. So what are you trying to do? Come now and describe. So in eliminating the asthmatic reaction, you want to administer oxygen and the bronchodilators, okay? Describe your management and put there a few lines, like 3 or 4 lines, not one line. You know, most of us, they put just one line. Introduce examples. Let this teacher get to see what is in your mind. Do not restrict yourself. Put the points there in a way that your teacher can see. My student knows how to actually describe or how to actually apply this work. How do you draw? You've been told to draw a diagram of the heart. So others get confused, like, am I going to do cross-sectional diagram? Am I going to do a longitudinal diagram? So the heart, most of the time, they may state for you if it's cross-sectional or horizontal, but if you just told to draw the diagram of the heart, it's always conventional that what you see is what you will draw here. So this is the heart. Someone has done this work and I felt they did a very good job, so I was like, I can use this to help my subscribers to understand how to handle it. So in drawing, I wanted you to note a few points, and when you're participating in a drawing question, be careful, because there are certain rules that guide how your marks will be given using a drawing. So the number 1 rule is your drawing needs a title, because the title has marks. If your drawing doesn't have a title, your marks are gone. Okay, so have a title. Draw using a pencil. There's mark for generally how the drawing look like. Imagine the fact that you tried to draw, the teacher looks at that drawing and has a mark for how that drawing look like. Is it neat? Did they use the right material? Did they start shading off in that diagram? They want to see that. So if you did it well, there's a mark for that general appearance of your diagram. And then we have now the aspect where you keep it neat. But again, as you're drawing, make sure you use at least 3/4 of the drawing space. So if you're using a full scarf, please ensure on that full scarf, 3/4 of that full scarf is used, please. Then if you've been given a drawing pad, please ensure 3/4 of that drawing pad is used. This is to ensure that whatever you draw is visible enough, someone can easily tell what you're trying to draw, and someone can flow with your diagram. So that's why they insist you use the space adequately. So use at least 3/4 of the drawing area. You rather use the whole place and get your diagram well balanced in that full scarf than squeeze your diagram into a small corner area and someone tries to struggle, you know, they're wondering, are you drawing a vein? Are you drawing an artery? What are you trying to point at? You know, don't squeeze your diagram. You've been given the right to use as much space as possible on that drawing area, and 3/3 of that space is for you. Then remember to name. When you're naming, I want you to note on our diagram here, we did not use arrows, okay? We do not use arrows. Avoid the arrow. There are people who draw the pointing and then they put an arrow-like appearance here. To avoid those arrows, just use a straight line that points straight to where you want to name it, such that someone will not confuse. So just use straight line, avoid using arrows. Then ensure your naming does not happen inside your drawing. So if you need to name, you name outside the drawing. So like here, he's naming the vena cava from the lower body. So someone, you will write this vena cava outside the drawing. You don't come inside the drawing and put a name. No, it's not allowed. And then after you have done all your drawing and you're done, generate a margin. So a margin is a border. So create a border and enclose this diagram all the way till you're done. So enclose this diagram all the way till you're done, so that it will either stay within a square margin or in a rectangle margin. That is part of the appearance of your diagram. And lastly, do not shade this diagram. Shading means there are people who get tempted and they start either coloring, these walls, or shading with the pencil inside this walls. You're not supposed to shade. So just leave the diagram neatly kept and no shading done or no coloring done. So as you can see, this guy here has done a very good job. You can literally tell it. And finishing up, the other questions we get are illustrate. And illustrate also sometimes comes with an attachment. They can tell you illustrate using a diagram. So by now, at least you know how a diagram look or should be handled. But again, illustrate can be coming in form of illustrate using a chart, illustrate using a graph. Those are all possible ways where you can be told to illustrate. Now, illustration and drawings come hand in hand, or they come together most of the time. The difference now where you are just drawing and leaving it like that, during an illustration, you're supposed to use the drawing or use the chart, but again, you need to add an explanation. You do not leave the chart in the illustration without an explanation. You need to explain it. So do not forget where you just draw the diagram and then you forget to explain it. You lose marks there. So when you're told to illustrate using a, then ensure you give an illustration after you're done with either the drawing, the chart, or whatever attachment you are asked to give. So remember to always describe what you have attached in that illustration. Discussion, they flow together with the description. So when you're describing, here it is deeper than, when you're discussing, here it is quite deeper than you're describing. So in this case, in discussing, you're told to put all the points you know in that paragraph. So the paragraph you use in discussing, they are quite longer than the paragraph you will use in describing. So I tell you again, separate your paragraphs. Do not put them as a continuous prose. Let your teacher know this paragraph is for the points I was handling up here. This paragraph is for the point I'm handling below, so that there is a clear demarcation, because marks are given as per the point you are discussing. So if you're discussing a point, give all the points you know clearly without leaving anything out. If you're discussing the management of this asthma, discuss nebulization like to the best of your knowledge. Do not leave any points undone or any points undiscussed. That's how you get marks in discussion. And the famous calculate. So like I told you, calculation can come at a practical level, but you can also be asked to calculate within your exam theory level. So here, like we said, you need to know the formula, and it's good when you're being asked to calculate to put that formula there. So if you're told calculate the dose of a certain drug, you need to indicate the formula. So start with the formula first, put it up there, then now go straight into calculations by indicating your values, numbers, calibrations and all that, but do not forget to state the formula first, or you will lose that mark for the formula. So do not forget it. So guys, I really appreciate this session, and if you enjoy coming here and learning with us, please remember to like, comment, share and subscribe to our channel. Thank you and see you next time. Bye bye.